Director of Admissions at UCSF School of Medicine.
Good morning. My name is Timothy Cranford. I'm the Dean of Admissions at Samuel Merritt University.
Good morning, everyone. My name is Ara Amidi Nuri. I'm Associate Professor, and I'm also Chair of the Bachelor of Science in Nursing program at Samuel Merritt University and the Director of Diversity, and most importantly, a registered nurse.
Good morning, I'm Tim Dutra. I am an assistant professor at the California School of Pediatric Medicine at Samuel Merritt University. But most important, I'm an alumni of Cal State University Hayward and East Bay. So it's great to be here.
I'm Bert Lubin. I'm a pediatrician. I'm the CEO and president of Children's Hospital and Research Center Oakland, which is now called UCSF Benioff Children's Hospital Oakland.
My name is Stephen Davis. I'm the Director of Admissions at Touro University, California, and I'm also an alumni of UCSF.
What are some of the skills that a physician or a nurse should possess to work in the field of medicine?
So I think curiosity and a spirit of innovation in what you're doing is always important if you're going to be practicing medicine. I think you should enjoy working with people and helping people. That would probably be good. I think in general, being sort of curious and also having a problem-solving aspect in your personality would be helpful skills in medicine.
I would say a well-rounded individual. It's not always about the grades. It's about actually having that empathy and sympathy to deal with individuals from very diverse populations. So not one particular thing. So we're not just looking at grades, but looking at a well-rounded individual.
So I'll speak on behalf of nursing. Compassion and care in your heart, as well as a love for sciences, particularly biology and anatomy and physiology, and a strong foundation in math, algebra.
I promise I'll keep this short, but this is really a great question. We just had this, this is common to us panelists, and I felt really bad. I just did one of these over at UC Berkeley Thursday night, and I forgot one thing, and that's a sense of humor. I really should have thrown that in because I think that is important. But I think sympathy, empathy, caring for people is very, very important. And again, being well-rounded, again, very important. The more we can experience what a lot of our patients go through, the more diversity and the more diverse background we have, I think really helps. And I think being motivated, and the bottom line is we go into healthcare to help people. So the critical part is you gotta actually enjoy people who complain, because that's all that happens. Is they're always griping and oh, this hurts, that hurts. Well, who cares? Go home. No. But you have to be able to deal with that. And then I think the other thing that's great is when you go into the healthcare profession, you have to want to have a very lively day every day. Every day is not the same. It's totally different. You might see the same injury, the same condition, but guess what? The people aren't the same. And I think that's a really great benefit of going into healthcare is we're always going to have clientele, aren't we? There's always going to be sick people, people in need. So I think that's very important. And then I think a sense of community is very important. I think you really want to engage not only in your practice community, but there's a lot of other opportunities, leadership opportunities. We can go into leadership roles at our, within our profession. So anyway, that's kind of in general, but there's a lot of qualities. When we interview students, that's what we're looking for. We want to know, why are you unique? What can you do for our program?
So, good morning. As I mentioned earlier, I'm a pediatrician. I've been at Children's Hospital for 40 years. And as my son, who's a little older than most of you, said, well, it's not a job, it's your life. So you're really entering a profession that this defines who you are. And you have a responsibility in that definition. And I think that responsibility is to be sensitive to the needs of the world and to our community. You will be seen differently when you come through an education and a healthcare career. And you'll have an opportunity to have a voice in your community. And that voice has to be culturally competent. It has to be a voice that recognizes the power that you have to really change the situations that we exist in now. The issues of poverty, of social determinants, of illness, of all the challenges that really affect health that your health oftentimes is more determined by your zip code than your genetic code. You have to be willing to consider that and to say, can I have a role in changing that? It's a wonderful field. I would choose it again. I've been in Children's Hospital for 40 years, started as a hematologist, and directed the research program for a number of years, and 6 years ago, I was asked to be the president and CEO of the hospital. And it's a hospital that cares about its community, and I want all of you to do the same thing, whatever community you choose that to be. And so this is it's a wonderful opportunity. Regard all of the presenters that have commented. I think I agree with every one of those things, and I'm sure you do as well. But I think it's really important for you to recognize your role as an advocate for improvement of health, advocate to address health disparities. And there are not enough people doing that. And so the young people are the people that will look at that. And it's really important to change our society so that everybody gets health care and not just those who are in the economic position to afford a type of health care that others don't get.
Okay, I'll be a conformist and use the microphone. I would say know and completely understand why you want to go into medicine. And if you think that reason is because of the money, think again.
So you can say, I'm an undergraduate, can I carry out research? What do I have to, which level do I have to be? In my lab, I tell them, hey, what do you want to do? I don't know. It's the first one, I say interest, I don't know, I'm trying to figure it out. Do you want to try out research? Yes, I do. Okay, come on in. Okay. Do I need to know organic chemistry? Should I have taken biochemistry? I said, no. You can learn in the lab. Okay, so I've had freshmen starting off knowing nothing, but coming out brilliant. And so I have sophomores, juniors, seniors, super seniors, and I also had postbacks. Okay? In fact, I'm trying to go more towards the freshmen because they tend to stay with me for a long period of time. Because one semester, if you go and start doing your research in your senior year, it just is not enough. You know, between your classes, you're trying to do this research and research that. Okay? And I wanted to go join the Doctors Without Borders. And I wanted to travel and I wanted to go treat diseases. I did not have a plan B. No idea what I would do if I did not get into med school. And guess what? I didn't get into med school. And I said, okay, I'll go do the next best thing. I'll go into research, biochemistry. Who wants to do biochemistry? But that's the closest thing I could think of to med school. And I had some of the brilliant mentors. So we teach you the process of how to do how to carry out research, and it is possible to explore your field of interest. So you could say, you know, I'm really interested in diabetes, or immunology, cardiovascular disease. So you can find out what your passion is. Lots of possibilities. Why do it? It's very enriching. Educational I mean for your academic career. Okay? A lot of students who have not taken biochemistry, I teach biochemistry for undergrads. When they come the sophomore year when they barely had their organic chemistry, no biochemistry, and when they come to my class after doing research, they know exactly. You know, you can say an NIH funded summer research experience at Children's Hospital Oakland carries a lot of weight. Okay, so that's, I have numerous other reasons. Oh, yeah, you get paid too. By the way, how nice is that? You get paid to have fun. That's why I think I have a very, very privileged job. Okay, so there are numerous programs across the country. Right, there's several universities, national labs, and because arises constantly. So when you go out into the world, we want to make sure that you are making the right decisions.
Just give you a brief history on me. This is critical care, what it's like to be a nurse in the ICU. My background is, that's all I've really been, is an ICU nurse. When I graduated from school, I went straight into an ICU, went through their training. It's a 6-month program.
First year
Came
nurse.
out, and I was fortunate that particular program in South Dakota had a mentoring program, so you could go and ask anybody, and they knew that you were still a new nurse and needed to learn. So they would help you out if you didn't know the answer, and help, you know, or if I needed just physical help. So that kind of gave me a lot of respect for nurses that had more experience for me, and the fact that I've always wanted to teach. I just didn't know what I was going to teach, but now I know what I wanted to teach, and that was nursing students. So right now I'm actually in the process of getting another master's. I hold 2 right now, but they say I can't teach a nursing student with the 2 masters that I have. It has to be a master's in nursing to teach any nursing students, just so you know. So I'm currently in the process of getting that myself. I chose to take my path since the future of nursing, I feel, is going to go towards informatics. But his wife and his daughter both came over to me and pulled me out of my room, and they just both gave me a hug and just a long hug, saying thank you so much, because what you did made his last few days the best days of his life, without even my knowing it. Did I know he was going to die eventually? Did I know he was going to die, this week? No, I didn't. I was trying to be as optimistic as he was. But that family and that patient stayed out in my mind the most.
Anyway, welcome again. My name is Bowen Wang, and I'm the grad programs manager for Capital Test Prep here in the Houston area. And essentially, my role as a grad programs manager is to work with student organizations such as AMSA to help put on these type of workshops for students. You guys, sometimes these kind of resources aren't available for you guys in the classroom, and we want to be there to support you guys in your research for medical school, again, personal statement workshops, and just learning what the MPET is about. I'm sure you guys are aware that the new MPET has changed, so it could be a scary thing for you guys at the moment, but really, once we break it down, you can, and with enough practice, the whole goal is to get you guys prepared for it. So you guys are all interested in attending it right now, whether you're a freshman, whether you're junior or senior. So I want to pose this question to you guys. Why are you guys interested in learning medical school? As you guys continue learning in your bio class and your chemistry class, the human body itself is very, very fascinating. And certainly through the journey, as we look through the journey of medical school, you're going to get the opportunity to really get a deep dive into mastering the body systems and how they all interact with each other and how medicine plays a role in that. So this is a very specialized field. Not everybody is equipped to be a doctor. Personally for me, I don't know if I'm to be a doctor. I don't know if I can handle the rigors of medical school. But for all of you guys, kudos to you. We need more of you guys. We need you guys to have the mental endurance to do it. So the demand for doctors is always going to be there, especially with the fact that we're not immortal. We're always going to get hurt. And again, the human body can only repair itself in a certain way. So with your applied knowledge of medicine, that's you guys are essentially helping us solve problems that we can't solve. The trend for medical school applicants is not going to dip anytime soon, even with the induction of this new MCAT. However, empty matriculants, it's kind of risen as well too with the amount of applicants for MD schools. Matriculants basically means if you apply to a school and you get accepted into it. Okay, so now we're going to switch gears a little bit, talk about something that's not so fun, not so sexy, but it's important. It's about funding your medical degree. I'm sure it wasn't a surprise to you guys that this is actually it's quite expensive. So it's a good idea to start talking to your family a little bit about what are the options. How am I going to pay for medical school? And just looking at the numbers alone, public school is about $32,000 for tuition alone, and the average tuition for private schools is about $52,000 in the state. And this definitely ranges. This is definitely different for all the different types of schools. But again, we're looking at averages. So and that's just tuition alone. This isn't taking into account housing or board allowances, book supplies, personal transportation. All that you're looking at spending maybe $60,000 a year just for medical school.
So the question was, what happens with exams that you take while you're in medical school? Is it just you take it and see how you're doing, or can you fail an exam and get kicked out? I can only speak for UCSF from first-hand knowledge, and then also from some of the other schools I interviewed at. But for the most part, it varies a lot by school. UCSF is, for the first 2 years, is totally pass-fail. So you have to get above a 70% to pass the exams during the first 2 years. Everything after 70% does not matter at UCSF. And most people will pass. There's a very small percentage of people who end up failing. And as far as I understand, it's incredibly difficult to get kicked out of medical school because of academic problems. I believe, I know a couple people that are in the Caribbean for medical school, and it's a little more strict there in terms of, you have X amount of times you can pass certain exams before they kind of pressure you to, yes, get kicked out. That's kind of some of my issue with some of the Caribbean medical schools. But that's secondhand knowledge from just my friends who go there. So, but yeah, for the most part, a lot of schools are pass-fail. Some have letter grades. It's just super variable. So that's actually a very important question when you're considering which medical schools to go to. It's definitely a very important question to ask the school directly to find out. Is this school a pass-fail? Is this school a letter grade system? Because that causes stress for some people, giving letter grades. It makes it very competitive, right? UCSF's kind of policy there is that, this hopefully creates a more cooperative, less competitive environment where students are really up to, quote unquote, get each other. It's just more like, okay, everybody, we need to be at a certain level to become doctors, so let's get at a certain level. Yeah, so what made me want to go into medical school? Very common, it's like a question everybody will get asked on any interview you ever go to for med school. So think about it, it's a very important thing. And hopefully you don't necessarily have to think about it too hard if your heart's in the right place. You're doing this because you want to. And for me personally, the reason I wanted to go to med school, I didn't have these stories where, sometimes you'll read or hear about people that, I had a light bulb, there's some epiphany moment where everything all of this came together. I saw one person, and boom, I'm going to med school. The reason I went to med school was for this kind of multifaceted kind of reason. It had many different phases to why I wanted to go to med school. And to me, I was very interested in, obviously, the medicine, like the science, right? Most people are. I liked how you can really help, quote unquote, help people. And I put that in quote unquote, because everybody says they want to help people, right? When they go into medical school, like, I want to help somebody. Well, you can do that in so many different fields, right? With medicine, and apply the really cool science behind it to help them. I love that about medicine. That was really, really cool. It was like, you get to study this thing that you love.
Because I was interested in the medical field, and then I kind of want to see what opportunities were available for me.
Yeah. Get more information to learn about the industry, and there's a lot of different career paths that you can go and check out. Primarily, a lot of people are trying to get into medicine or healthcare. So this actually provides a lot of information, a lot of things that people might have not come across, or some things that you won't find on the internet. Something like Dean's panel, where it's a lot more interpersonal, specific questions that's more geared towards where people are trying to go.
To kind of pick the brains of nurses who are in school and nurses who are been in their career for many years. I wanted to come here to learn how to get to medical school and what the representatives expect, what to look for, different fields in medicine.
Yes, the one from sure. Like, he does podiatry. He was the most helpful and most interesting because he talked about doing things that you want to do rather than things for an application.
A lot of people, especially, because I'm pre-med, a lot of my classmates or colleagues or whatever, they look at research kind of like a box checker because it's so competitive, It's so competitive to get into med school, and it's like, well, having a research experience actually helps you out. It's something that would look really good, and so they're kind of not really looking at it for the curiosity, but more as a box checker, because a lot of the ones that they are curious about, the ones that they really preferred usually are filled up or there's limited staffing. So it's like, okay, well, I have to do something else. So they look at other research labs and other opportunities, and it might not be particularly everything that they want it to be, but you know, that's something that they thought they should do.
Pretty much leave after that, I feel like I learned a whole lot. That the first thing they tell you, it's a lot of schooling, it's expensive, so in the back of your head, you already know all that.
They told me the interview process and how rigorous that was going to be.
The instructor, many years of experience behind her.
It gives a lot of information of the schools, what they look for, GPA, tuition, salary, what else? The MCAT. Yeah, the MCAT, they touch really, like, they went, the speaker went in depth on the MCAT and the cost and what to do and how to prepare for it.